Hi, everyone. I'm Chen. I'm a fourth year medical student, and today I'll be discussing the environmental and health impacts of single use water bottles. Let's start with the environmental footprint, the hidden cost of these bottles. The resource drain is staggering. Producing a single PET bottle takes up to 2,000 times the energy needed to supply the same amount of tap water, and it wastes 1.4 gallons of water just to manufacture one plastic bottle. We also can't recycle our way out of this. Right now, only 24% of plastic bottles actually get recycled, and the overall US plastic recycling rate is a dismal 5%. Because the system is so broken, roughly 1.5 trillion single-use plastic containers have ended up in the landfills between 2015 and 2024 in the US. But this plastic doesn't just sit in landfills. It ends up inside us, creating an invisible threat in our drinking water. The normal wear and tear of handling a bottle, like squeezing it or leaving it in a hot car, causes the plastic to shed polymers directly into the water. To put it into perspective, a landmark 2024 study from Colombia revealed a single liter of bottled water contains 240,000 plastic fragments. What's most alarming is that 90% of these are nanoplastics. Because they are smaller than a single micrometer, they can easily cross the intestinal wall and even breach the blood-brain barrier. Now, let's look at the health impacts of microplastics. A landmark 2024 study in the New England Journal of Medicine demonstrated that patients with microplastics embedded within their carotid artery plaque faced a 4.5 times higher risk of adverse cardiovascular events. This finding is crucial because it defines the attributable absolute risk these particles pose to cardiovascular health. Beyond the cardiovascular system, emerging evidence shows that microplastics are likely associated with significant GI and neurological effects. For example, a 2022 study showed that patients with inflammatory bowel disease had significantly higher fecal microplastic concentrations at 41.8 items per gram compared to 28 in healthy controls, which positively correlated with their disease severity. Furthermore, a 2025 JAMA postmortem study found that patients with dementia had significantly higher microplastic tissue levels, over 26,000 micrograms per gram, compared to 4,131 micrograms per gram found in individuals without dementia. However, it is important to note that while these associations are alarming, ongoing studies will need to be performed to fully establish causation and determine the exact absolute risks for these GI and neurological conditions. So what can we do about it? While individual choices like using a reusable bottle are a great start, we need systemic policy changes to stop plastic pollution at its source. Two powerful strategies are extended producer responsibility, or EPR, and deposit return system, or DRS. EPR policies shift the financial burden of managing plastic waste away from local taxpayers and place it directly on the corporations making the packaging. This is especially vital for rural communities where waste management infrastructure is often underfunded. When companies have to pay to clean up their own products, they quickly pivot to sustainable packaging. Alongside EPR, we need strong deposit return systems. By adding a refundable deposit to beverage containers, regions like Oregon have redemption rates near 87%. By pushing for these systemic changes, we can keep plastic out of our landfills, our ecosystems, and ultimately our bodies. Thank you.